Well, good afternoon, and thanks for joining us for today's brand new Healthline 3. I'm Courtney Butts, and today's topic is heart failure. Joining us to give us a preview or to talk about this is Dr. John Winterton with Willis Knighton Piermont Cardiology. Thanks for joining us.
Thank you. Thank you. Again, it's an opportunity to visit and help people understand the significance of heart failure, which has substantial implications relative to cost, to patient lifestyle and enjoyment of life, and certainly mortality.
Yeah, okay. And we were talking in between breaks and things, but you mentioned this is something that's very common.
Extremely common, probably on the order of about 29 million people in the United States. It's the result of several factors: heart artery disease, coronary artery disease. The problem that causes heart attacks would be the leading cause of heart failure, but the risk factors that lead to heart artery disease also cause heart muscle dysfunction. Both cause the heart to be weak, but also the heart to not relax. And inclusive in that list are diabetes, hypertension, high cholesterol, smoking, sedentary lifestyle, and genetics. But for instance, high blood pressure plays a substantial role. High blood pressure affecting roughly 75 million people in this country now, which effectively doubles the rate of heart failure, heart attacks, and strokes as well. So several major issues that we deal with on a day-to-day basis, which individually don't seem like much. You can take care of your high blood pressure, you can take care of your diabetes, but when you put all those things together, can affect heart function. And if you develop heart muscle dysfunction, in other words, heart doesn't pump well, build up fluid, causes symptoms, and is associated with mortality.
Right, okay. And so the heart is one of the most important organs, obviously, in our bodies. So tell us a little bit about, a normal function of a heart and then what it looks like to have heart failure.
Well, heart is responsible directly for blood flow to the rest of the body. And therefore it's directly related to brain function, to lung function, very importantly kidney function, all of which impact day-to-day lifestyle and survival. The heart pumps has two sides to it. It's a right and left side. The right side of the heart pumping blood to the lungs. The left side of the heart pumping blood to the brains, arms, leg, kidneys, internal organs. We typically are referring to the left side of the heart when we talk about heart failure. And if the left side of the heart doesn't pump well, obviously the rest of those organs can't function well. When that happens, it causes blood to back up in the system. And that's where the congestive heart failure term comes from. The congestion is involved in fluid buildup in the lungs. And so when pressure builds up inside the heart because it's not pumping well, fluid, water backs up into the lungs. If that continues or worsens, it will back up throughout the remainder of the system. Unfortunately, the right side of the heart does not pump well against high pressure. And that's for a reason, because the right side of the heart pumps blood to the lungs. If that were under high pressure, it would force fluid into the lungs. Unfortunately, when the heart doesn't perform well, it can't tolerate high pressures, and so fluid backs up, and that's what causes the other major symptom of congestion, which is swelling, that people commonly speak of.
Okay, so a common symptom would probably be that edema or the swelling in the extremities?
Right.
Okay.
Right. That's usually a symptom of advanced heart failure or congestion that's been going on for a substantial period of time.
Gotcha.
Shortness of breath would probably be the more noticeable and more important to notice symptom early on.
I was about to mention, those early warning signs especially when you have that fluid buildup. Would you say the shortness of breath is that common one?
Correct. And actually, even before that, we hear people talk about their inability to function at the same level that they're accustomed to. So a loss of ability to perform daily activities or reduction in their tolerance of their activities is an early sign that something's not right, and Obviously the earlier it's caught, the easier it is to intervene and have an effective outcome.
Absolutely.
Impact.
Yes, well, if you were just joining us, Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll have that phone line open right now, and we'll be taking your calls and answering all of your questions about heart failure. That's what we're talking about today. And that number to call is right there on your screen, 318-219-4569. And when you do call, make sure you're in a quiet room so that we don't get any TV feedback and we can hear your question when you do ask it. Again, 318-219-4569. Okay, so we're talking about heart failure, and let's say someone is diagnosed with heart failure, but there's different stages when it comes to heart failure. So if you don't mind going through what that means.
Over the last 10 to 15 years, the research community and as represented by the American College of Cardiology and the American Heart Association, as well as the American Society for Heart Failure, have developed a classification scheme that helps us understand where a person is relative to their heart failure diagnosis. Mm-hmm. And it classified into a letter scale, A, B, C, and D, and A being effectively unrecognizable heart failure, unrecognizable in the way of symptoms. The most common, roughly 72% of the patients who have heart failure have stage B heart failure, which interferes with subtle activities in daily activities of life. Stage C would be more advanced heart failure, people who are having to substantially limit what they can do, limited to minimal activities, et cetera.
Right.
And then obviously stage D then would be people who are at the end stage of heart failure that are hospitalized or bedridden, and obviously that's what we hope to avoid. Mm-hmm. Fortunately, it's roughly 6 to 10% of the population that has heart failure.
That are in stage D.
In stage D, that's right. So roughly 72% in stage B, which is the part where we have the most ability to impact the disease.
Right. Okay, well, we have our first caller. Kaylee, thanks for joining us, and what's your question for Dr. Winterton?
Hi, Dr. Winterton. My grandmother is coming to town for my graduation next month. Is she safe to fly for our daily activities that we have planned with heart failure?
That's a good question. Heart failure does pose some limitations in a patient's ability to tolerate circumstance. Altitude is associated with reduced oxygen concentration in the air, the ambient air, and that puts some strain on the heart if the heart function is not normal, can make you more symptomatic. Commercial airlines are pressurized to an altitude of about 5,000 feet, so that their oxygen level should be compatible with travel for somebody with stable heart failure. Now, someone who's acutely short of breath obviously doesn't need to be in an airplane. They don't need to be in the airport traveling like that. That would be a bad idea.
Okay.
Thank you so much.
Thanks, Kaylee, for your question. And if you're just joining us and you have a question for Dr. Winterton, we're talking about heart failure. Give us a call, 318-219-4569. Okay, so we were talking about staging just before that, and let's say you're in stage B. Is there any way that a patient can reverse their condition to stage A?
You can improve your stage quality using the various mechanisms we have to treat heart failure. The first objective is to identify the cause of the heart failure or heart muscle dysfunction. And if it's reversible, for instance, in the case of heart artery disease, which can be treated with medications, with stents and bypass surgery, and improve heart function, then you could see a reversal in the course of the disease, so an improvement in the stage. Medical therapy for heart failure has improved dramatically over the last 15 to 20 years. That too can improve a functional class or stage of the disease today.
All right, great. Well, Bob, thanks for joining us, and what is your question?
Hey, good morning. Thank you for having me. I had AFib, probably a couple of years ago, and it was getting bad. And Dr. Dominic went in and did a the ablation and haven't had any more problems with that. But a continued issue is it's called PVC, premature, doctor probably knows
Premature
what it's called.
ventricular.
And they put me on medication. It's just a heart thump, in this past January, 10 months ago, 11 months ago, it was just a hard thump in my chest, and it was like once or twice a week, no big deal. Well, now I have it daily, and it's worse, it's stronger, it's uncomfortable, and the cardiologist I'm going to right now just says, nothing to worry about, here, take these pills, and they gave me the Toprol XL. We tried 50 milligrams for 3 months, and it didn't change anything. Now I'm on 100 milligrams, and I'm just kind of worried that maybe I need a second opinion on, what's going on with my heart. Do I need to, just keep taking the beta blockers? They're not doing it. 100 milligrams not doing anything. Several times a day, I notice it more when I'm lying down. Probably once an hour, once every 40 minutes or something. I have no idea. I get this blam in my heart. It just like it stops beating and it goes blam.
Right.
They did insert an Abbott, what is it called? Scrolling monitor or something under my skin. I don't know if Willis Knighton can read that.
Yeah,
Willis Knighton, give me a second. Can you give me a second opinion? Well, I'm going to die in the next year. Come on, help me out here.
So the issue that you're describing is what we call palpitations. On the basic level, that's the title for that type of symptom. It's common in lots of different circumstances. You had a history of irregular heart rhythm, as you alluded to, and certainly it's conceivable that could recur. If it's been identified to have the extra heartbeats coming from a different origin, such as PVCs, which implies that they're coming from the lower part of the heart, usually have a different cause.
Yes,
right, and so that needs to be investigated further from the standpoint of overall heart function. Poor heart function, which is what we were discussing with heart failure, is associated with heart rhythm disturbances, some of which can be life-threatening, and so that does need to be investigated further. Now, from a standpoint of monitoring,
I agree.
Monitoring at home is possible, and we have some advanced monitoring systems that can be implanted. They're the size of the clip on a ballpoint pen, and very small. It's a very innocuous procedure to implant that device. And yes, it can be monitored through Willis Knighton. We have that ability to work in conjunction with the manufacturer of that device and see heart rhythm disturbances.
You can work with the Abbott. If I give you the model number, give you your office,
Sure,
all,
yes,
all the details.
Sure, and we'd be glad
look back
to help.
And I don't know, going there and click that. There, it is in the bottom part of my heart. That's what she indicated. And
yeah, that sounds like it needs more assessment, and I would encourage you to discuss that with your doctor, and certainly.
Well, I'm talking about. I would like to have a second opinion, if I may. I do have insurance coverage, that kind of thing. I can talk to your office about that, but I'd like to make an appointment. What is required to make an appointment for this kind of follow-up with your team?
Certainly, we're happy to help in any way we can, and the easiest thing to do is contact our office at Piermont Cardiology. Our facility is in the Medical Arts Building behind Willis Knighton Piermont, and we have the ability to take care of all of those issues, certainly. And I would urge you to consider having someone look into this a little further, be it your current cardiologist or the cardiologist of your choosing. All
right, great. And do you mind having that? Do you have that number by memory to call?
318-212-3958.
All right, good, and it's right there on your screen. So if you needed to make a phone call or schedule an appointment with Dr. Winterton, you cover all things with the heart, right?
That's right.
All right, good deal. Okay, so when you think about heart failure, one of the first things that you probably think of, I guess in your standpoint, this is probably what you first think of, maybe not everybody else, but fluids is a big thing that you want to monitor or restrict. Why is that, and maybe what is the typical recommendation?
So, as is true of most medical problems, there are several components to treating an issue, and one of those is certainly the things that we have to offer, be it mechanical treatments or medications. Mm-hmm. But it always involves the interaction of the patient, and I feel very strongly that patient interaction and patient involvement in their care is critical. And you're alluding to dietary assessment and management relative to poor heart function. Probably the single greatest offender for patients with heart failure is sodium. Sodium, in a biochemical sense, moves through cells. It's vital in function for nerve and muscle function, and certainly has its beneficial effects. Too much sodium can alter the amount of fluid volume in the body, and therefore the amount of water the body has to deal with. When there's excess fluid, the heart has to contend with that excess fluid. Mm-hmm. And as that excess fluid builds up, it will back up in a poorly functioning system into the lungs and into the venous system. Therefore, sodium restriction and water restriction become a serious component of the treatment for heart failure. In general, patients with severe heart function, muscle dysfunction, need to adhere to a 2-gram sodium diet. That's the current recommendation for patients with significant left ventricular dysfunction. Mm-hmm. That sounds like that's a very easy statement to make. Mm-hmm. It's an extraordinarily difficult, practical thing to accomplish.
Especially with fast food at your fingertips.
We absolutely live in the wrong place for a 2-gram sodium diet. But dietary instruction and involvement of the system that's available to everyone in our community through the Willis Knighton system as well as through the American Heart Association and American College of Cardiology internet available materials to achieve a diet that is consistent with doing well with heart failure.
Mm-hmm. Yeah, great advice. Well, Paul, thanks for joining us, and what is your question today?
My question is, hello, doctor.
How are you?
I'm all right, but I've had 4 stents put in, and I've had 3 heart attacks. All right, I'm 5'9", and I'm at 160 pounds, and they took me off sodium.
Hey, Paul, do you mind turning your TV down for us?
Yes, I don't mind at all.
Okay, thanks. That might help.
No, I do not mind. I'm going to walk into another room.
Okay, there we go. Okay, so you mentioned the sodium, right? You mentioned something about sodium. That's where you left off.
Yeah, they took me on all off sodium.
Okay.
And they made me quit smoking.
Those are
I'm 64
keys to
years
treatment.
old, and I'm 64 years old, and I'm semi-active more than I try to be. What can I do to improve my health time?
So that's a very good question to ask as a patient, is what can I do? And certainly talking to healthcare professionals and getting the proper identification of the cause of your heart disease is critical, and engaging the system to reverse or treat reversible causes of heart muscle dysfunction is very, very important. That would also include getting the proper medications and taking them as advised.
I lost weight. They took me off all medications.
Well, so as the part that a person can engage in their own care involves sodium restriction and water restriction. Sodium restriction is a complicated. Go ahead.
Now, sodium restriction, I do. But I'm having problems with water restriction. I want to drink Gatorade and iced tea and stuff like that. Is that bad for me?
So the sodium restriction, as I mentioned, 2 grams sodium, that's a technical term, and that's a complicated statement, really. And to answer your question, you referred to prepared drinks and so forth. Sodium is in a lot of places that we don't commonly think about. For instance, prepared soft drinks, prepared energy drinks, prepared volume resuscitating type substances. You mentioned Gatorade. All of those have sodium in them. And you have to account for the sodium that's in everything that you take in. The water side of heart failure management, we generally recommend that people try to achieve about a 1.5 liter fluid restricted diet. In other words, they take in 1.5 liters of fluid total during the course of the day. So how do you avoid the sodium? Sodium is in everything that we touch.
It's in milk. Everything we do, it's got some kind of sodium in it.
That's correct. And so you can add salt at the table. Most people today are conscious of the fact that you should not be adding salt at the table. However, anything that's preserved
I use
sodium.
no salt.
Yeah.
Yep.
I use no salt.
Well, but the bigger problem is
it takes a while to get used to it, but Doctor, you've been more than helpful to me.
Well, I'm glad that we can provide some insight.
All right.
Right. I just need to watch how much water I intake.
Correct.
And the sodium goes hand in hand. All right. Thanks, Paul, for joining us. And if you're just joining us and you have a question for Dr. Winterton, that number to call is 318-219-4569. Okay, so we talking about heart failure, and we were talking about Mamie is just joining us, and I'll wait for my question and get to Mamie's question first. Thanks for joining us, and what's your question?
Hello, good morning, doctor.
Good morning.
I have a family history of congestive heart disease, and I see my cardiologist twice a year, and he said my heart is in good condition. But I have a tendency to get tired, and when I spoke with my family physician about it, he asked me if I had considered my age. I'm 84 years old, but I'm used to moving all of the time, but I've slowed down lately. So would that have anything to do with my heart?
Well, that's a very good question, and I think it's important to recognize the significance of that question, because you're alluding to not being able to do perhaps what you'd like to do or what you're used to doing, which is one of those subtle symptoms that something could be not right with your heart. Now, that doesn't necessarily mean that you have heart failure or heart disease of any kind, but it certainly is something that would cause us to be interested in investigating those symptoms. Subtle symptoms can often be a clue that something's going on up and in front of before the major manifestations of a big problem. So that I would encourage you to discuss that with your doctor, because that is a, while subtle complaint, could be a sign of something that's not right.
Well, thank you very much. I appreciate your answer, and I appreciate you being there for us. Thank you.
Yes, ma'am. You have a good day.
Absolutely. Yes. Okay. So we've talked a lot about the symptoms and things to maybe lifestyle changes to do, but what are, when someone is diagnosed with heart failure, what are the common treatment options that you pursue as a doctor?
First and most importantly is identify the cause of the problem. So is it heart artery disease? And in that case, we do have the ability to treat heart artery disease both with medicines and mechanical options. Of the mechanical options, the only option associated with improvement in survival is certain circumstances that require bypass surgery. Stents can relieve symptoms, and in some rare cases it help improve heart function. But bypass surgery is the single statistically verified way to treat heart artery disease and have improvement. Now, as I mentioned, over the last 15 to 20 years, medical therapy for heart failure has advanced significantly, and we have a relatively simple and clearly identified regimen of medications that we like to use to treat heart failure, and they are associated with improvement in survival, reduction in the need to be in the hospital, reduction in the need for other restrictions. So it's identify the cause, and if there's some reversible cause, be it blocked arteries or heart valve disorders, then treat those. And then in addition, add the medications that are appropriate. And as has been represented in the phone calls, help people adjust their lifestyle to accommodate for this so that they do their part, which is very, very important.
Yeah, okay. So when we talk about heart failure as well, there is a number that you're looking at, right, when you're diagnosing it. Is it the ejection
fraction.
Thank you.
Yes.
Yeah, tell me about that.
So about half of heart failure patients have heart failure with reduced ejection fraction. The ejection fraction is a sort of magical number that is artificial, but it represents the amount of blood that the heart pumps out each time it beats. Normal being somewhere between 55 and 70%. Heart failure with reduced ejection fraction then is implying that the heart function is not normal. And that's about half of the heart failure patients, about 19 million in this country. The most common cause for the heart muscle not pumping like it's supposed to would be blocked arteries. That's about 60 or 70%. About 15 or 20% is related to valvular heart disease, heart valves that are too narrow or leak. And then the remainder are metabolic diseases and a significant component, 5 to 10%, that we don't know what the cause was. Viral infections would be in that list.
Okay.
The other half of heart failure patients have heart failure and their ejection fraction is normal. And that's a completely different process. That process is related to the heart not relaxing. If the heart doesn't relax, it can't fill up with blood properly. If it can't fill up with blood properly, pressure builds up in the system and then is reflected back to the lungs. In other words, fluid reflected back to the lungs.
Gotcha.
Causes the symptoms. Unfortunately, that group of patients who have normal ejection fraction also have the same degree of mortality. It's a very serious form of heart failure and under-recognized. How do you treat it? Well, there's some treatments for the metabolic diseases such as amyloid and sarcoid and such, but also treatments for the more common causes, the most common cause being hypertension. As I mentioned earlier, about 75 million people in this country have hypertension, maybe as many as 45 million not undergoing treatment or not recognized. And the implication of that is substantial relative to morbidity and mortality, but also on a practical side, a huge cost to the healthcare system.
Right. Okay. Well, Dr. Winterton, thanks for joining us. We have about a minute left, so tell our viewers where they can find you.
So our practice is at Willis Knighton, Piermont, the Piermont campus. The office itself located in the Medical Arts Building behind the hospital. We're part of the larger Willis Knighton system. Our practice and the system itself is capable of offering all the services available to heart patients of any kind, be it heart artery disease, valvular heart disease, heart rhythm disorders, and heart failure.
Great, good deal. Well, thanks for joining us. Good information about heart failure. And if you missed this will be on our website at ktbs.com/podcast or /Healthline3. Dr. John Winterton, thanks for joining us, and we hope you have a great day. Okay.